It's my honor today to introduce Dr. Pete Smyth. And it's kind of unusual. This guy is my neighbor, and Judy and I go walking, go by their house almost daily, but at the same time, when we were unloading the back-to-school goods, his wife happened by and wondered, what the heck were we doing with all these boxes? So two things happened all at once. We talked to Pete about Rotary, and then there was more interest in Rotary through Back to School. So the arms of Rotary are tremendously worldwide. Pete Smyth grew up in Lester Prairie and attended the University of Minnesota Medical School, graduating in 1972. Then he joined the U.S. Navy, stationed at Great Lakes Naval Base and the Marine Corps base in Guantanamo. And he comments that when he was in the Navy, he never saw a ship. I guess that works. He went to the Mayo Clinic in Rochester after the Navy and finished his internal medicine residency in 1978. He practiced internal medicine in Glencoe, Minnesota for 34 years. Pete and his wife, Barb, now reside in Eden Prairie. He has 3 children, 8 grandchildren, and in our neighborhood, we know when the grandkids are there. There's all kinds of chalk on the driveway, and we have a very wide sidewalk, and there's at least 6 or 7 kids going up and down the street. Pete was a member of the Glencoe Rotary Club for 33 years, serving as president and foundation chair. Jim and Jim, foundation chair. Okay, guys. As Jeff mentioned, I've talked a lot about Rotary. He is now without a club, and he mentioned something about Eden Prairie, and I said, well, why do you want to drive all the way out to Bear Path when you can come to Bloomington, which is a heck of a lot closer? So we're working on it. Please welcome Pete Smyth.
Thank you. Thank you, Jim and Judy. I do have just one correction. I was not at Guantanamo, it was Quantico, but my typing skills are not very good. And so I had to point that out. While it is true, I was in the Navy, never saw a ship. I was stationed with the Marine Corps at Quantico, Virginia, so. I grew up in Lester Prairie, Minnesota. How many people here know where Lester Prairie is? More than average. Little town, kind of west here in McLeod County. After the Navy and my residency, I went back to Glencoe, Minnesota, which is the county seat of McLeod County, where Lester Prairie is located, and practiced internal medicine. 5 years ago, I retired, and we moved to Eden Prairie 2 years ago, and I worked half-time for Alina doing nursing homes and transitional care and all that, and I retired August 30th for the last time, my wife says. My story is a little bit about something that could happen to any one of us, but normally happens to somebody else. On the week of the 4th of July, 2013, we joined several of my wife's family members, about 20 of us altogether, and we went on a cruise of the Maritime Provinces of Canada. We flew to Boston, met up at a restaurant, went out around the old town, some of you know Boston, ate a little too much pasta, drank a little too much wine, but we really enjoyed all the family members, went back to the hotel, had a good night, got up, ate breakfast, and the ship didn't we couldn't board the ship till 1 o'clock. So my wife and I went on just a walk around Boston Harbor through the parks, enjoying ourselves. And about 10:30 in the morning, I began having some pain in my abdomen. Well, you know, we'd been out the night before, clocks are disrupted, all that kind of stuff, so didn't think too much about it. Got on the ship, couldn't eat, went to supper that night with the family. The aromas just upset me so I had to go back to the room. And this kind of went on for a day or two. Sometimes a little better, I could eat a little bit or drink some fluids. Couldn't get off the ship, didn't do any of the day programs, didn't do anything like that. My wife went to the program on board ship on Monday night, and I stayed in bed. And she got back from the program probably about 11 o'clock at night. And I said, you know, I've got to go to the doctor. As you know, I am a retired physician, but I said, I need help. I haven't eaten for 3 days. I was getting dehydrated. I know this is a luncheon meeting, so I won't be too graphic, but things weren't going through the way they should, and they were coming out, and they were coming up instead of going through, and all that sort of stuff. So it's 11 o'clock at night, and I called the doctor's clinic, and the lady said, well, it's going to cost more because the clinic is closed on the ship. We're out in the middle of the Atlantic Ocean somewhere. I said, I don't care. You know, so she came down, and the ship's doctor was an American from Illinois. He was kind of a crusty old snort, but my wife said, you got to be careful about referring to older doctors that way. But he was very good. And he said, I think you have an intestinal blockage. And I said, so do I. And so we're out in the middle of the ocean. So he got an IV started. He gave me some medication so I could sleep. In the morning, I felt a lot better, but he came in and re-examined me. I slept in the infirmary there on the ship. And in the morning, he came in and re-examined me, and he said, you're not any better. And I said, I know. I felt better, but I could tell nothing was working. So he made arrangements for me to get off the ship at a scheduled stop, Sydney, Nova Scotia. Anybody here know where Sydney, Nova Scotia is? It's almost in Greenland. I mean, it's way out on the end of Nova Scotia. And they had a regional hospital there. I equate it to a hospital in something like Fargo. I mean, it was far away, but it was a regional hospital. They had 6 general surgeons. It was a reasonable place, but I didn't know. So you're a victim of what's going on. And he made all the arrangements. And I said, I was still able to walk and everything. I said, well, let me just take a cab. He said, no. In the Canadian system, and I'm going to get into that a little more, if you arrive in a cab, you'll be in queue, and you won't get seen till sometime this evening, if we're lucky. So he sent me in an ambulance, so I got right in. Well, I got to the emergency room doctor, and again, you know, a blockage in my intestines. So they did some x-rays and things. By about 4 in the afternoon, they had a surgeon see me, and they all agreed on the diagnosis. They put an NG tube, that's the tube that goes in your nose down and evacuates, I'll use that word, all the contents that's there. And I felt a lot better. I mean, that was manna from heaven. I didn't need any pain medicine after that. It got rid of all the garbage. So then the surgeon said, well, I'll check you in the morning. So I slept all night in the emergency room. Ship left. That's kind of an unusual feeling. A little Robinson Crusoe day, you know, when you're there and my wife's there, and then the ship left. The next morning, the surgeon came in and said, you're not any better. And I said, I know that. And in the meantime, I had some x-rays, had a CAT scan, had all that. I had very good medical care. So the surgeon said, well, we could do another CAT scan. I said, well, what's the point? He said, exactly, I've already put you on the surgery schedule. So that afternoon, I had surgery. No informed consent. I never signed anything, nothing. But the surgeon was very, well, even as a physician now, I understand why people love their surgeons. He was very forthright with us. He sat my wife down. You're 67 years old, you have an intestinal obstruction, we're gonna operate on you. We're not sure what we're gonna find. We're not sure what's going on. And you know, well, we all knew that. If we were laying there on the gurney, we all realized that. Well, he took me to surgery. Surgery was less than an hour. I had an internal hernia that I was born with, he said, and he fixed it, went out and talked to my wife, and so there was no cancer, no malignancy, he fixed this hernia. So I woke up, I felt great. I could tell that everything had been fixed. However, I'd been sick for 4 days with nothing working and my intestine tied in a knot. So we waited a day and then he started to feed me, but again, nothing worked. Everything came up, nothing went through, and I had what's medically referred to as an ileus, I-L-E-U-S. That is where after you've been injured, the normal snake-like activity of your intestines stops. So there's nowhere to go. So the NG tube, the nasal tube went back in, the IVs went back in. I was actually feeling reasonably well, but nothing was working. It stayed that way for 12 days. So if you think of a bad bruise, if you get a really bad bruise on your leg or your arm, you get swollen, it gets black and blue. It takes 10 or 12 days for that to resolve. That's exactly what happened to my intestines. It was damaged, it was bruised, it was sick, had to get better. So at the end of 12 days, things started to work. I hadn't had anything to eat. They gave me over 40 liters of IV fluid in the week. They gave me, I had wonderful medical care, urgent, the nurses were wonderful. I could get up and walk around, but I always had to take the IV pole with me, like you see in the movies. And finally, though, things started to work, could eat again, got out of the hospital 2 weeks after surgery. Went to the hotel, the surgeon said I couldn't leave town for 3 days. He wanted me up and around and doing all that, so we did that. And then we flew home, and I got better. I have a lot to be thankful for. So that's the story. Now I'm going to go through the process a little bit. So, and I'm going to start back on the ship. We went to the ship's doctor. The ship's doctor saw me in the middle of the night, did all the IVs, and if you've ever cruised and ever been to a ship's doctor, the bill gets put right on your account for the ship. I was slept in the infirmary. I had 3 or 4 liters of IV fluid. A nurse did sit with me all night, and the bill was $1,700. In the morning, we got an ambulance ride to the hospital. Very nice. I mean, 6 or 8 blocks. The bill was about $800. I didn't bring the list with me, but I'm close. Emergency room. I was in the emergency room for over 24 hours. Very good care. The bill was $500, something like that, and then the emergency room doctor was $125. Got admitted to the hospital. I was in the hospital 13 days. Are you ready for this one? The bill was on one piece of paper. One 8x11 piece of paper. And the bill was $34,000. 15 days in the hospital, 40 liters of IV fluid, all intensive post-operative nursing care, and all that. The hospital bill came and it was charged per diem like a hotel. And the only thing that I know that we had to sign was that we realized that. And I was considered a foreign national, Canada, and so we had to sign a permit saying that we realized what the bill was. So all together, 2 weeks in the hospital, all of this, the bill was about $35,000. Now my wife and I chose, what do you do? I decided early on, when I was really pretty sick, I decided early on, I can't worry about the money. I mean, if I started worrying about that, I wouldn't get anywhere. So my wife had the Blue Cross card, so she worried about the money, But at the time, I was 67 years old, but I was not on Medicare. I was still working for Alina, so I had Alina Commercial Blue Cross. And my wife and I had a little chat, and we paid the surgeon $1,200. That was his fee. We paid the anesthetist $400. That was her fee. We paid the ambulance crew, and we paid the one other bill. I think the emergency room that we paid in cash. The hospital bill was about $31,000, $32,000. I turned that into Blue Cross and asked them to pay it directly. They did after about 9 months and many phone calls. And they kept asking Blue Cross. Now, I'm not angry at Blue Cross, although I was probably at the time. If you go to a hospital in a foreign country, Blue Cross, all the individual state Blue Cross offices, I never knew this, have a national office that takes care of international billing, and it's somewhere in Florida. So you had to call down there, and they took care of saying, oh yeah, you were really in the hospital. I said, yeah, I really was. And then they approved it, then it went to the state, and the state had a real hard time. And they said, we need more information. Well, I sent them the one-page bill. That's what I had. And also, no code numbers. You know, nothing like that. It was just, you know, for services rendered, you had surgery, here's the bill. Well, I finally found somebody at the Cape Breton Hospital in Canada, and they faxed my record, somewhere around 200 pages, to Blue Cross, and then they paid, you know. So, and then they reimbursed us. I can't complain, really. They reimbursed us for the bills we had paid in cash. And altogether, it was about, as I said, $35,000. Now, there's some unknowns here as well. That in no way covered the cost of my care. $35,000. It was not anywhere near enough for the amount of IV fluids I had, even just the pharmaceuticals that I consumed. So I have to be pretty much, I'd like to say eternally grateful, but on the other hand, I survived all this, you know. Very grateful to the citizens of Canada. Their 15% sales tax that pays for their health care in Nova Scotia contributed immensely to my medical care. I have no idea how much. I have no idea where the breakdown was. And so it was a very unusual experience, and I have a couple of takeaways. First of all, my wife was able to stay with me. So we left the ship, she got a hotel room, and so we were in the hotel room for almost 3 weeks, if you count the time when I got out of the hospital. We did have trip cancellation insurance. And this becomes a real issue because I was really sick and we didn't know what to do. And we were even in a foreign English-speaking country that had Western medicine. I have no idea what would happen if this happened to you on an African safari or even in South America, some places. But anyway, the trip cancellation insurance, they paid my wife $100 a day for expenses for her to be with me. They took care of canceling the trip. They canceled the airfare that we were supposed to take home at the end of the trip. And they worked with their travel agent to fly us home from Sydney, Nova Scotia, which is a little bit like trying to fly home to probably Miami, Florida from Bismarck. I mean, Sydney, Nova Scotia is a little town way out on the end of the peninsula. And so they were able to find a flight. We went from Sydney to Toronto to Minneapolis, because we tried to get a one-stop. They wanted us to go Sydney to Halifax to Toronto to Minneapolis, but we were able to get a one-stop flight. So now I went to the Medicare meeting because I retired, now I'm on Medicare. So I told my story and I said, what would happen if I had Medicare? And the lady who was actually doing the presentation didn't know. She said, you probably would have to pay cash and then talk to us when you got home. I don't know if that's the, you know, the Medicare covers nothing outside of the United States. I don't know. I'm assuming it covers Guam and Puerto Rico since that's part of the United States, but it covers nothing. The supplements we all buy, if you're on Medicare, says that it covers emergencies. Well, I really had an emergency, you know. But my brother even said, why didn't you get a jet and fly home? Well, I was too sick at first. And then by the time I could have done that, I was well enough that another 3 or 4 days in the hospital and I was going to just be able to fly home commercially. So, you know, I don't know the answer to some of those questions. In some countries, if you go to a hospital, they want 10 or 15K on your Visa card before they even examine you in the emergency room. Canada, I have nothing bad to say about my medical care or the way I was treated in Canada. They dealt with me as far as the bills go after I left the hospital and when I came home. I had to argue with Blue Cross a little bit, and that bothered me because I thought, you know, I'm kind of a retired physician. I kind of know the vocabulary and know the rules. I could argue with them a little bit. How many people would simply not argue and the bills would never get paid? You know, I mean, that was a little troublesome to me. So anyway, the takeaway is, thank God for every day you have, and buy trip cancellation insurance. And don't get sick in a country that doesn't have Western medicine. You know, I appreciate your comments about Denmark. I mean, it's a different kind of a system. So, and I'd like to answer any questions anybody has. Oh, one quick thing. 2 years ago, 2015, I took my wife back to Nova Scotia. Because even though we spent 2 weeks there, what we saw was out of a 2 foot by 2 foot hospital window. And we rented a car and had 2 delightful weeks doing the bed and breakfast thing all around Nova Scotia and Prince Edward Island. I pulled into the parking lot, and I don't remember a lot of this, you know. I pulled into the parking lot of the hospital that I was in. And I said, do you want to get out of the car? She said, no. So we drove on. But we did get back to see Nova Scotia. Yes, any questions?
Have you done a comparable what the bill would have been in the U.S.?
Well, informally. Informally, I talked to some of my colleagues about Abbott Northwestern, you know, I mean, and probably the bill would have been 3 or 4 times as much, between $100,000 and $120,000. The other thing was that in Canada, they kept me in the hospital, even though the only treatment I was really getting was IVs and, you know, getting a daily examination, making sure that I did not have a fever, did not have any of that. So I very likely would have had to go to an extended care facility in the US, which would have been okay. It's just that in Canada, they were able to keep me in the hospital. Mm-hmm. Yes?
I would never travel internationally without the medical, at least the medical portion of trip cancellation insurance. But it sounds like Blue Cross Blue Shield, your regular insurance, really covered the medical part. What if Blue Cross Blue Shield wouldn't cover? Would I'm assuming your medical portion of your trip cancellation would have covered.
Yes, I think they would have, and that might have been one reason why Blue Cross and Blue Shield, and this maybe sounds critical, I don't necessarily mean it that way, dragged their feet a little bit. At the end, when we had all the bills paid, and it was, you know, 10 months later, so this was 4th of July week, we're talking the next April or May. The trip cancellation insurance has you put the entire packet together, and by the time I got done, it was about a little over an inch thick, and mailed it to them. And then they did an audit of all the paperwork, and we got a check for another $1,500 made out to us. And I think some of that was the co-pays and deductibles and all that. I don't remember itemized what that was. So if they had not paid, I think there would have been, I mean, that might have been another argument, so to speak. I mean, we'd have had to go there and say, hey, we're looking for coverage here, right? The other thing is there's some things that are kind of humorous in retrospect. They weren't at the time, but Blue Cross Blue Shield originally denied the ship's doctor because it was an out-of-network clinic. And that's what the letter said. So I just simply wrote him a little note, and I said, hey, look, we were out in the middle of the North Atlantic Ocean, you know? There was nowhere else to go. And I had this intestinal blockage, and you know, letter was maybe 2 paragraphs long, and they paid it. Then they paid it. They didn't argue. But you know, it bothered me that I even had to do that. So how many people wouldn't write the letter back and say, hey, look, this is the way it was. There was nowhere else to go. Yeah, you have to be a little bit tenacious, I discovered. I do this for a living, you know, and you had to be a little bit tenacious with the medical insurance company to get your coverage. Yes, somebody else had, yes.
When you were practicing, how many different insurance companies did you deal with, do you think?
Oh, I don't know if I can even say that. You know, at first it was quite a few back in the 70s and 80s, but now in Minnesota, this is an entirely different topic. I don't even know if you want to go there, but you know, there's only 3 or 4, 5 insurance companies left in Minnesota. Health Partners, Blue Cross, Medica. You know, maybe some big interstate corporations have some other private insurance, but most of them have been merged or acquired. Yes?
Why is this big difference between, say, 4 times the cost here versus the Canadian system? Is it that it really costs 4 times and they are just taking, government is bearing the cost of it?
I think there's 2 or 3 things to answer that question. Number one, I'm certain it is cheaper. Maybe the total cost is 50%. But let me give you an example. The hospitals are all double room. No television unless you rent one from a private company. Okay? If I didn't rent one, I was too sick. I was sleeping all the time, but there's a TV in there, and the hospital calls a private company, and they have a little coin thing or whatever, and you turn it on to get the TV set. The hospital needed paint. And I said, you know, and there's a hole in the sheetrock where somebody ran a gurney into the sheetrock, and a little hole there. And I said something to the nurse, and she said, oh yeah, we're scheduled to be remodeled, you know, next summer. The orderly was changing my bed one day, and my wife said, there's a hole in the sheet. And the guy says, oh yeah, kept making the bed. So, and I'm making fun of it a little bit, but what does it cost to have all private rooms? What does it cost to have flat screen TVs? I mean, all of that stuff. I had wonderful medical care. What can I say? They saved my life. But all that extra stuff adds on to the bill, and I think, I mean, that was a lot. I had a double room. My first roommate was a woman. And, you know, being who I am, I said, that's a woman. And after 4 years of medical school, I knew the difference, you know. And the nurse just said to me, look, you're sick, a bed's a bed. I said, okay, you know, end of that discussion. And actually, she was right. When you're really sick, it didn't make a lot of difference, you know, so. But I think that's part of it. It's all of that plus the ambiance of the hotel. You know, our hospitals are so competitive. I never really much thought about this till my experience. Somebody else updates their OB department and puts in jacuzzis, then all the hospitals around them have to do that. Yeah, so it's a lot of that. Now, I do think they could have had a janitor kind of fix the sheetrock, but they didn't. So, yes.
This is kind of an advertisement, I guess, as opposed to a question, but we were just talking about it earlier. Have you looked into or do you know about medical evacuation insurance?
Oh, yes, oh, yeah. In fact, I have a policy that's a consultative policy, and my wife and I pay, I don't know, because we're still traveling quite a bit, so we pay $60 or $80 a year. And it's not an insurance, but it's a phone number, an international phone number. So if you're sick somewhere, you can call this, and then they organize it for you. You know, it's that kind of a policy. And we thought about doing that, but we were in Canada with Western medicine, and we didn't have a language barrier. Everything just worked out well, so we didn't invoke that. We could have made the call to do that, but we didn't. And as I said, my brother is a very categorical, everything is either black or white with him. And he said, why don't you get a jet and fly home? Well, within 6 or 8 hours, I really had a comfortable feeling that my medical care was very good there, so we just stayed. I didn't know how the bill was going to get paid, but I was very comfortable with that. Otherwise, we probably would have. Yes?
So you are complimenting and affirming the Canadian system. And that's what I'm hearing?
Yes, I am, but there's, just like everything else in life, there's a but. Emergency care like I had was wonderful, and where I happened to be in Nova Scotia, I had very good care. In fact, when Blue Cross was not paying the bill, one of my arguments was, it'd be cheaper for you to fly people to Sydney, Nova Scotia and have them have their gallbladder out than it would be for them to do it in Minneapolis. However, the downside, thanks for the question. I have it on my notes, but I didn't get there. If you have a total knee, you can wait 2 years in the surgical queue, as they call it. And then if something happens, you get a cold and they have to cancel your surgery, you go to the end of the queue again. Elective surgeries are very, very difficult. I'll just use that word. Now, I chatted with the nurses a lot in the hospital because you're laying there with nothing to do. And they were very happy with the obstetrical care and with the pediatric care and all that, but it was elective surgeries, emergency room visits with sick kids. You can wait a long time. Getting an MRI, if you have a bad back and you need an MRI, you can wait weeks to get an appointment in the MRI schedule. So that's correct. Did you have something?
Yeah, a follow-up then in our system, which is immediate, we're bankrupt.
Correct.
And medical doctors are retiring early because they don't want to put up with the hassle anymore. So, I mean, how are we to walk out here this afternoon and compare those two thought patterns with what you're saying?
Well, the first answer to your question is I don't know. The second, though, I'll give you an opinion. I think a lot of our and I was a physician in a small town, general internist, medicine was good to me, I'm not going to lie to you, but I think our expectation, starting with does everybody need a private room? Do we need television sets? Do we need all this kind of stuff when you're in the hospital? All the way down to how, you can get into fees and all that stuff too. My surgeon, I chatted with him a bit. I have no idea what his income was, but he had a sailboat on the bay out there in Nova Scotia. He was living a reasonable, life, but he told me he'd probably make a lot more money if he was in the US. I don't know that. So I don't know the answer to your question, but I think part of it is, it's probably both sides. Part of it is our expectation. We can have good medical care with double rooms and no TVs.
What about the liability insurance, which is over the top for the doctors here? Do they have some limits up there?
Well, the whole Canadian legal system is different. That includes medical liability. Now, if there's any attorneys here, you might be able to answer this better than me, but if you want to sue your doctor for malpractice, you have to post a bond indemnifying him if he wins. So that if you want to sue your doctor for malpractice, you have to say, okay, but if he wins, I pay his legal fees and do all that. So that's a pretty good, now I'm speaking as a physician here. Attorneys would probably be the other side, but that's a pretty good deterrent unless you're really pretty sure you have a good case.
That's in Canada, that's not here. So
No.
why can't we get there in this country?
You'd have to ask a lawyer and they'll lobby that.
I don't have enough time.
Our TV ads say, you can sue and there's no settlement unless we win. Well, there it's just different. One more question?
Sure, we have time. Just more comment. Here in the U.S., you can get a knee replacement in a couple of weeks. I know from experience. And unfortunately, trying to get your primary to pay real attention to you is just about as hard as getting an instant knee replacement in Canada.
Well, you know, I don't, one more quick comment. A few years ago, I had the opportunity to do what we call an observership or clerkship in England. Similar medical system, a little different, but. And at that time, I had had a hernia fixed, just plain old-fashioned hernia, like probably many of you in this room have had. The surgeon there could not believe that I went to my doctor and that the doctor asked me when I would like my hernia fixed. And I said, next Tuesday. And he called, and I got my hernia fixed. And he said, well, what if the doctor wouldn't do it next Tuesday? I said, I'd go to a different doctor. You know, you can't do that in some of those systems. I don't know an answer to your question. I mean, there should have been a way you could get referred when you needed to be referred. That's all I can say.
You can get referred. You can see all the specialists you want, but try to get coordination of care.
Oh, that's a tough, yeah. Especially now in the world of hospitalists and clinics and all that. Anyway, thank you very much. I'll be around for a little bit. So.
And Pete, as a small token of appreciation for our club for speaking today,
Thank
it's a
you.
Rotary pen, and we sure like to see you come back and give us some more consideration in the upcoming weeks.
Thank you.
Thank you.